Welcome back to Inside Chlorpromazine, the podcast where we explore the unexpected but fascinating roles of chlorpromazine beyond its traditional uses. Over the past episodes, we have discussed its effects on viral entry, replication, and immune modulation. Today, we are diving deep into a topic that ties everything together: autophagy and how chlorpromazine might influence viral clearance. Once again, I'm joined by a guest, a microbiology researcher with expertise in cellular process. Welcome back, Chaitanya.
Thanks for having me again. Autophagy is such an intriguing subject, especially when considering its role in viral infections and how chlorpromazine could impact that process. I'm excited to break it down.
Let's start with the basics. What exactly is autophagy and how does it play into viral infections?
Autophagy is the body's process of self-digestion. It's a way for cells to break down and recycle their damaged parts. Think of it as cellular housekeeping. In the context of viral infections, autophagy serves as a defense mechanism. It can help clear out viral particles or even degrade viral components before they can replicate. There is fine balance though. If autophagy is too active, it might cause cellular damage, but if it's too weak, the virus might escape and multiply. So, autophagy is crucial in controlling viral load, and viruses like SARS-CoV-2 have evolved ways to hijack this process to their advantage. They may even try to inhibit autophagy to allow for more replication.
Now, let's bring chlorpromazine into the picture. How does this drug impact the autophagy process?
Chlorpromazine have been shown to modulate autophagy by influencing the lysosomal pathways. Lysosomes are key players in the autophagic process. They are the structure that break down unwanted cellular debris. Studies suggest that chlorpromazine can increase autophagic activity, possibly by altering the way lysosomes and autophagosomes fuse. The drug's impact on the endocytic pathway might play a key role here. Acids can affect how viral particles are delivered to lysosomes for degradation. So, chlorpromazine isn't just blocking viral entry or replication. It could potentially enhance the cellular ability to clear the virus by ramping up autophagy.
This is really interesting. So, chlorpromazine might actually help the body fight the virus by increasing its own defense mechanism.
Exactly. Autophagy isn't just a cleaning process, it also helps with immune modulation. By clearing viral remnants and damaged cellular material, autophagy can activate immune cells and improve the overall antiviral response. This is especially critical in long term infections where the virus might evade the immune system. So, chlorpromazine could, in theory, help tip the balance in favor of effective viral clearance, especially in chronic infections or in post viral syndromes like COVID-19.
That brings us to long COVID. We have discussed how persistent viral material might contribute to symptoms. Do you think chlorpromazine's impact on autophagy could help in clearing residual viral material in long COVID patients?
There is a growing body of evidence suggesting that viral persistence might be a contributing factor in long COVID. Even though the acute phase of the infection is over, remnants of the virus or its components may remain in the body, leading to chronic inflammation and a variety of long term symptoms. So, chlorpromazine could theoretically help in clearing these remnants by boosting autophagy. If the body can effectively degrade viral particles, it might reduce inflammation, helping long COVID patients recover more fully. However, this is still speculative. Clinical trials focusing on chlorpromazine's role in long COVID are still in the early stage, but it's a very promising area of research.
Are there risks, though, if autophagy is overstimulated? Could this backfire?
Yes, there is an excellent point. Like any biological process, autophagy needs to be finely tuned. If it's overactive, it could damage cells and tissues. For example, excessive autophagy in certain contexts have been linked to cell death. So, chlorpromazine's role in autophagy modulation needs to be carefully balanced. We don't want to stimulate autophagy so much that it leads to unintended cell damage, but just enough to help with viral clearance without compromising the host health. This is a delicate balance and would require precise dosing and possibly combination therapies to ensure the benefits outweigh the risk.
Given this delicate balance, could chlorpromazine be combined with other drugs to enhance its effect?
That's exactly what many researchers are exploring. Chlorpromazine could be used alongside other antiviral agents that target different steps of the viral life cycle. For example, combining it with protease inhibitors or RNA polymers inhibitors could attack the virus at multiple levels: entry, replication, and clearance. In this context of long COVID, it could also be combined with immunomodulatory drugs to ensure that the immune system is being overstimulated while autophagy is being enhanced. However, as with any combination therapy, careful trials would be needed to ensure safety and efficacy.
Chlorpromazine's potential in treating viral infections like COVID-19 is becoming clearer. Do you think it could have broader applications in post-viral syndromes beyond long COVID?
Absolutely. Post-viral syndromes, whether it's from influenza, Epstein-Barr, or even viruses like Zika, involve similar mechanisms. Residual viral material causing chronic inflammation. If chlorpromazine can help with autophagy, it may be useful in a variety of viral diseases. So, we might see a paradigm shift in how we treat not just the acute infection, but also the long term consequences. Autophagy and viral clearance could become central to managing chronic post viral conditions.
It's fascinating to think about how a drug that's been around for decades could have such wide-reaching implications for viral infections and even long COVID. Chlorpromazine's influence on autophagy could indeed be a key piece of the puzzle in managing both acute and chronic viral diseases. Thank you again, Chaitanya, for your incredible insights into how chlorpromazine could aid in viral clearance and autophagy modulation. We have only scratched the surface of its potential. In our next episode, we'll be taking a closer look at chlorpromazine's effects on viral-induced inflammation and how it might contribute to reducing chronic symptoms. Until next time, stay curious, stay informed, and thank you for tuning into Inside Chlorpromazine.